Thanks, Kelly. Well, we've seen a lot of questions online this week about a new study claiming mouthwash can actually destroy COVID-19 and also lower its chances of spreading. So our Verified team is taking a look at that.
Let's start with the headlines. Mouthwash and oral rinses may combat coronavirus. Mouthwash has potential to protect from COVID-19. So let's verify. Did a study find that mouthwash can combat or protect us from coronaviruses? Well, to find out, we checked the study itself and spoke with the lead researcher, Dr. Craig Myers. Here's the study in question: lowering the transmission and spread of human coronavirus. A team of researchers at Penn State tested multiple brands of mouthwash on a strain of human coronavirus in a lab to see what might happen to the virus if someone rinsed or gargled with them.
And we found that even at 30 seconds with some of these products, we could wipe out 99.99% of the virus.
Now, the paper shows multiple brands of mouthwash destroyed upwards of 99% of the virus with just 30 seconds of exposure, and were even more successful at longer durations. So yes, this study did find that certain mouthwashes can destroy coronaviruses. But what does that mean for you?
These are all things to protect others, and that's always our first. The first statement we make. You know, we're not replacing masks. We're not saying, there's people on Facebook who are already saying, oh, now we can get rid of the mask. No, that's not the case.
Dr. Myers said the research shows that sick people who have a lot of active virus in their sinuses and mouth could make themselves less infectious by gargling mouthwash. Now, this would help if you're quarantining with someone sick or at places like dentists' offices where they have to be close to someone's mouth. But as he said, it's not meant to replace masks or social distancing. This study reflects only the active virus in your mouth and sinuses and doesn't eliminate the virus from the rest of your body.
You know, if you have virus sitting on your tongue and you rinse with this, it should be able to come in contact with the virus, and therefore it would be able to inactivate it. But again, it's a time thing. You know, if you have virus, its job is to get inside your cells, and once it does that, none of this will work.
Keep in mind, these are early results. Their goal now is to take this to clinical trials so they can see how effective mouthwash is on real people. Oh, and last point, Dr. Myers said the type of mouthwash does matter. Most big brands or their generic versions should work, but we have the full list from their study up on our website. With your Verify, I'm Jason Putnam.
It's very interesting stuff right there, because Indiana is seeing several high days of new coronavirus cases. State health leaders reporting more than 2,500 cases just yesterday alone. That's down about 300 from Thursday's record-breaking total, but still very high. And another 27 Hoosiers have died from COVID-19. All these record numbers mean more Hoosiers are being diagnosed in October than any other month. Get this, more than 3 times the number in June alone. There's still more than a week to go in our month. The positivity rate in Indiana is staying steady at 6.9%. That is not good, because, you know, the goal for Governor Holcomb and the health officials has always been to stay under 5%. Well, it's not just Indiana seeing an increase in cases. Cases are spiking all over all the states across the country. U.S. Health and Human Services Secretary Alex Azar says it's time for people to be more accountable for their actions.
This is being driven by individual behaviors at this point. The community spread is happening because we've got to keep focused on washing our hands, watching our distance, and wearing our face covering when we can't watch our distance, and in particular being careful in household gatherings. This has become a major vector of disease spread.
And new research is out showing that masks do work. The study is from the University of Washington. Researchers believe without a universal mask mandate, more than 500,000 Americans could die from COVID by the end of February. But by just requiring masks across the country, 130,000 of those lives could be saved. To date, more than 224,000 Americans have already lost their lives due to COVID-19. Well, IU Health Methodist is among the hospitals planning to expand its use of remdesivir to treat COVID-19. That's after the FDA approved the drug to treat hospitalized patients 12 and older with moderate symptoms. Before, it was for only severe cases. The drug is not a cure, but it can reduce the severity of symptoms and the recovery time for some patients. One man who spent 6 days in the ICU believes this drug, remdesivir, was key to his recovery.
I don't think it was like, you know, you take penicillin for a sore throat and it goes away. But I'm alive, which I'm not sure that I would have been without the remdesivir. It really made a big difference to me.
Because it can shorten a patient's hospital stay, and that frees up more beds in the ICU, which is especially important when we see a surge in new cases. Well, starting December 1st, Southwest Airlines will no longer limit the number of seats for sale on each flight. The new policy means middle seats will once again be filled on flights with strong demand. The airline limited seats for months due to the pandemic, but American Airlines and United Airlines have been filling seats for months. Southwest said passengers on fuller flights will be able to rebook to another flight if preferred.